But we are blessed lot of doctor being gynecologists that we can care for 2 lives and not one like other doctors. So we feel fortunate about it. આ બધી સારી લાગણીઓ સાથે ઘણા બધા પ્રશ્નોના જવાબો આપવાના આવે ત્યારે મેડમે કીધું એમ અમને અઘરું લાગતું જ હોય છે કે લસ્ટર માટે કંઈક કરો એમ. હવે એવું કોઈ ડસ્ટર અમારા પાસે નથી કે લસ્ટર બદલી દેવાય, એવી કોઈ જાદુની છડી અમારા પાસે નથી, અને અમે ડૉક્ટર્સ તો પેલી ફેર એન્ડ લવલી જેવી કોઈ એડ પણ નથી બનાવી શકતા. Instead of that, we are in process of making a few educational and motivational video, not only for women but for all in the society. કે કદાચ આપણને એ સાંભળીને જીવનમાં ઉતારીને એવી સમજણ આવે કે આ લસ્ટર જરા આગુ બાજુ થાય તો ચાલશે, પણ આપણું ઇનર લાઇટ જેટલી વધારે આપણને અનુભવાય એવું કંઈક જીવીએ તો મજા આવે. Riddhi is to talk on a very different topic. She runs her own hospital with the name Arogyam Specialty Hospital. She's also director to GKSF Eurocare, who are pioneer in offering kidney stone services on wheels. મોબાઈલ વેનમાં કિડનીની પથરી તોડી શકાય એવું એક એમનું અતિ સુંદર સોશિયલ મોડલ છે. She is co-founder to Naari, and myself, Riddhi and Kaushal Ben, we have come up with a space called Health Cafe, જેના માટે આજે ડૉક્ટર યમુનાદત્ત અગ્રવાલ આપણી સાથે છે. After this slot of talk and between talk and the panel, we'll be launching it officially today. May I invite Dr. Riddhi Shukla to speak on physical and sexual health of women. Before she moves on to her presentation, I just have to say one thing, કે હજુ તો આપણે એવા સોસાયટલ કન્ડિશનિંગમાં જીવીએ છીએ કે જ્યાં આપણને એવું શીખવવામાં આવ્યું છે કે બાંધી મુઠ્ઠી લાખની, ઘરની વાત તો કોઈને કહેવાય જ નહીં, અને જેટલી નથી કહેવાતી ને એ બધી રોગ બનીને બહાર આવે ને ત્યારે ડૉક્ટરની ઓફિસમાં ઠલવાય છે. We are not here to change the society. We are not here to change your own belief system. I am just drawing your attention that how can you move ahead and can someday bring a change in the society in small little way which you can. કોઈકે બહુ સરસ કહેલું છે કે small little things can make perfection, but perfection is not a small thing. સો આખા સમાજને બદલવાની કોઈ ખેવના રાખ્યા વગર ખાલી પહેલાં આપણે આપણી જાતને બદલી દઈએ, પછી થોડીક આપણી આજુબાજુવાળા માણસોને અસર થશે ને ધીમે ધીમે સમાજ સુધી જવાશે. આવો મારો આશાવાદ. મેડમે કીધું એમ કે કામ કરતાં કરતાં થાકી જવા છતાં કાયમ અકબંધ રહેતો હોય છે, એના માટે I thank the Almighty. Sexual health is a topic which women usually don't talk so easily, or else they talk only with the friends. ડૉક્ટર પાસે તો ત્યારે જ જાય કે પછી ના રહેવાય એવું થાય, પણ એક આખી બીજી દુનિયા જીવે છે જેના વિશે રિદ્ધિ વાત કરશે.
Good afternoon. On behalf of Naari, I welcome you all once again, and thank you so much for our esteemed speakers for sharing knowledge and various perspective of mid-age women's life. As you see in the picture, that the theme of today's program is mid-age women. There are 4 stages of a flower, out of which the one which is fully blown, most beautiful, is a mid-age. Many of us must be asking that what is mid-age? I was talking to Aarti Ben just before that. Initially, women used to have those hormonal changes after 35, 40, and now she feels that it has started a bit early at age of 30. So I would say that young age ends at about 30, 35, and old age start 58, 60 onwards. So in between the time period, what we call is the mid-age. It is the maximum period which women lives. And someone was sharing, I fully agree, that it is the age where you enjoy a lot. Yes, life begins at 40 because you are a bit relaxed. Of course, the responsibility is never going to go away. Women never want to put down her responsibility. આપણને રસોડામાં એક શાક મારા બદલે આ થયું, એ રિસ્પોન્સિબિલિટીમાંથી આપણે બહાર નથી આવતા. તો we cannot live without responsibility. Women try to define herself that suffering is what women is. So she wants to suffer, she wants to live with the responsibility, she doesn't want to live it. But whatever the age period, this is the most beautiful period of women's life because she is mature, she is independent, she is relaxed, and she wants to enjoy the life. After marriage, she is entered into the phase where she has moved on her life, starting settling along with the husband. When kids are small, it's a lot many responsibility. But when your kids are growing, of course the responsibility is there, but you enjoy this life period. So that was the reason why we wanted to keep the program with especially addressing the mid-age health issues. The physical health, as Darshna rightly said, that health is a various aspect. It's emotional, psychological, financial, spiritual, all aspects. It's not just the healthy, but the physical health is most important because it's a visible. If somebody is mentally down, emotionally not well, પણ FB સ્ટેટસ જોરદાર મૂક્યો તો you feel, oh wow, look at her, I want to live your life like that. But physical health, it is seen. So from the physical health of the woman, you can make out that, okay, she is not well, she is bit down. So physical health is a critical for overall all well-being of the women, and it is most visible of the all various dimension. It includes, as I said, social, financial, intellectual, emotional, spiritual, many. Madam rightly said that that there is a hormone called estrogen which starts secreting in the pubertal age. આપણે કહીએ ને કે 16 સાન આવે ને 20 વાન આવે, એમને એમ ના આવે. It is a hormone which is making you mentally stable. It is a hormone which is giving you beautiful curves or beautiful mind and body of a female. So female life is hormone dependent. મારા ઘણા ડૉક્ટર ફ્રેન્ડે કહે કે બહેનોને બહુ તકલીફ, ઘડીકમાં તમારો હોર્મોન ડાઉન ગયો, ઘડીકમાં અપ ગયો, એના પ્રમાણે અમારે જીવવાનું. યસ, menstrual cycle is a variation of hormonal changes. Just before the period, there is a estrogen deprivation. So you feel lonely, you feel like crying, your body is bloating. So when estrogen is going out from the body for just 2-3 days before period, you feel lot many changes. So these are the changes a woman is going to come across when she is entering to the mid-age and beyond. Because it is a hormone which is a protective umbrella to the female body. Madam said that it gives a bone support, joint support. Then estrogen or feminine hormone keeps women's blood on a thinner side. તમે 30-35 વર્ષની ઉંમરે કોઈ ફિમેલને હાર્ટ એટેક આવે એવું નહીં સાંભળો. ઇટ્સ વેરી રેર, બટ ઇટ્સ પ્રિટી કોમન ઇન ધ મેન. ધ રીઝન બિંગ ધીસ એસ્ટ્રોજન પ્રિવેન્ટ અસ from those rarely diseases because it keeps the blood on a thinner side, it keeps your bone strong, it gives support to your skin, mucosa, vaginal mucosa, urinary bladder mucosa and overall skin. Then once this hormone is going off, why the mid-age women are concerned about so much of health issues? It's said that when you are aging, on your birthday people wish you have a nice health, not the wealth or anything else. So that because as you are moving in the age, especially women, these hormones starts declining. Many of the time, as Darshna said, anybody is walking in our consultation, she may be hardly 36 or 37. I said, what happened? She said, menopause છે ને એટલે મને આમ થાય છે. So we have that mentality to stamp everything to the menopause. Pain, if it is a body ache, it is menopause. You are down, it is no, it's not like that. The hormone which is secreted say 15-16 years of the age, it is in the body till 50-52 years for the Indian standard. This is the time that the estrogen is working. Of course, after 40 years, it is slowly starts declining. So once these hormones start declining, as madam says, you will come across with the osteoporosis, chances of diabetes, blood pressure increases. Those who have family history of diabetes, blood pressure, or any other endocrine disorders, they are more prone to get these diseases. Cardiac and respiratory. As I said, that your lung capacity decreases, your muscle strength and support is going to decrease. So there are some sort of balance issue arising. All the muscles of the body start having little bit of decreased tone. So many of the time a woman feel when she laughs loudly or when she coughs, there's a little bit drop of urine which is leaking out. That is because when you are aging, the muscles are becoming weak. The estrogen is not supporting the vagina and urinary bladder mucosa. So she starts losing control over her bladder. Then skin and hair, something which is self-esteem. થોડા બી આપણા વાળ ઉતરવા માંડે તો you get disturbed. અરે so many of are coming down to my clinic and asking મારા વાળ બહુ ઉતરે છે, મારી skin આમ થાય. So this is something because woman is defined with her beauty. She is a one, તમે woman ને beautiful જ describe કરી શકો in whatever age she is. So skin and hair problems starts arising, vagina dries up, the urinary mucosa gets irritated, they start finding loo off and on, they start avoiding going to the social functions. Usually they avoid, no, I cannot hold urine, so I don't want to go. So these are the issue which starts when she enters into the mid-age, and they persist lifelong. Now what to do? The thing is, when we know that this is going to happen, so you have to start working on it. The changes which you are going to face after 40, 50 years of the age, for that you have to start working right at the age of 30, 35 years of the age. You have to start something called bone bank, where you have to start taking calcium supplementary food, or some medicines, or calcium rich food. You have to start doing exercise. Exercise plays a very important role in the prevention of osteoporosis. If your muscle will strong, you have to do all sort of exercise. And be sure, whenever you are doing exercise, always consult somebody and then do. આપણે કોઈ એક્વા એરોબિક્સમાં ગયું તો આપણે ગયા, કોઈ યોગામાં ગયું તો આપણે ગયા, but every body is different. You cannot just choose the exercise because somebody else is going for it. So exercise is must. Which exercise is good for you? What is your body structure? How much you can bend? Depending upon that, you have to start doing exercise, and you have to choose right exercise. You have to see consultant or physiotherapist and then start doing. You just cannot do at the age of 40, 45 aerobics na kudka marwa without asking. You should not go. You have to ask, consult, and then go. As I said, the losing controls, and those who are having family history of diabetes or hypertension, they are more prone to come across these problems in the mid-age. Now, as I said, the exercise is the key. You have to start. There is a very good Gujarati કહેવત મને બહુ ગમે છે કે 40 પછી 40 નહીં તો ક્યાંય 40 નહીં. So you have to walk at least for 30 to 40 minutes. Many of the time patients are telling, બેન મને ઘરમાં જેટલું કામ હોય છે ને શું ચાલવા જવું, કે તમને શું ખબર મારે કેટલું કામ હોય છે. So I know that women life is molded, but it is doing something extra from what you are doing. Because your bones need extra support, your skin needs extra support. So you have to run that extra mile to take care of your bone and muscle. Fitness at mid-age, if I want to summarize, then your 80% diet should be fruit and vegetables and more of a milk. You have to start doing weight-bearing exercise. You have to start strengthening your muscles. As I said, happiness moment. You have to find your happiness moment. લગ્ન કરીને સ્ત્રી આવે ત્યારે એટલા બધા સપનાઓ લઈને આવે, એટલી બધી આશાઓ લઈને આવે. એક વખત સાસરીમાં પ્રવેશ થાય એટલે ધીરે ધીરે સાસરી સાથે, પતિ સાથે એ સંઘર્ષ કરતી કરતી સેટલ થઈ જાય. A woman is exactly coming from one environment and we are putting her in a different environment. She has lot many hobbies to do. She has thought something different for her life. But as she goes on when kids come, there is adjustment, readjustment, times clashes, especially for working women and those even at home. તો એ બધી હોબીઝ આપણે ભૂલી જઈએ, બધા સપના ભૂલી જઈએ. And when you are entering at the mid-age, kids would say, મમ્મી તું બહુ outdated છો. You have forgotten what your hobbies were, and husband will find that you are hobbyless, nearest. So this is what she has come across to reach to this mature stage. So find your hobbies, rejuvenate, relax, and de-stress yourself. That is the key in this age, especially in mid-age, to remain healthy and happy. It is medically proven that exercise can prevent these many long diseases. So exercise is very, very, very important. Whatever the form, you can do it. Please start doing it. You have to deposit your money in a saving account. Okay? અત્યારે ખાલી saving account ના પૈસા જ કામના છે, બીજા બધા ના કામા છે. So start putting your saving account right now. મને finance બહુ ગમે છે એટલે I can easily click this with this. Now coming to the sexual health. Discussing sexual health is very difficult because every culture, subculture, individual has a different perspective, different parameters. So it is very difficult to discuss it out. But especially for the mid-age women, I found that it is a topic worth addressing because we have seen that many of the time, the society which we live in, the Indian society where marriage is a custom, husband and wife, one male and female, are living with just the one partner for the rest of their life. So your all needs, all your mental, physical need is one man and one woman. many of the time, many scientific studies and research has found out that sexual desire can be a physical need for a man, but for women it is a mental need, it is an emotional need. She enters into the sexual relationship because she wants to show her feelings to the husband, or she wants to become a happy, or she wants to make closeness to the partner. That's why she is entering into the sexual relationship. It's not only the physical desire, it's a much more beyond that. So when we are talking about sexual health, it's not just about preventing the infections, preventing unintended pregnancy or physical pleasure, it is much more beyond. By WHO, World Health Organization, sexual health is defined as a physical, mental, social well-being in relation to sexuality. It requires positive and respectful approach. These two words are very important. The positive as well as respectful approach. You need to develop that approach towards you first, then towards your partner, and the rest, society and family comes rest. Okay. Possibility of having pleasurable and safe sexual practice without any discrimination and violence. What is the importance of sexual health? As I said, it is very important for overall physical and emotional well-being of the women. It gives you a mentally strong mind, physically you become, so it's a physical and emotional need. It is a very important component of quality of life. It can be influenced by many factors. Some health issues are arising in the mid-age, or there are some problems, some infections, or the most important is there is always threat of becoming pregnant, even beyond age 40. So Madam Kaushal, Madam Darshna, we usually recommend all our patients beyond 40 years of that when you are crossing 40, it's not that you stop having sex, but you start using a preferable contraception, enjoy life. It's not like that. It is a myth and belief that after mid-age, women becomes less sexually active. Many studies have shown that she enjoys her life maximum at mid-age, whether it's a emotional health or a sexual health or financial health, the all perspective reaches to its height in a mid-age. There are different perspectives. Somebody never wanted to discuss anything even with the partner. And there are certain people who are open about it. So how you are taking is very important. Nobody is right, nobody is wrong. There is no harm in discussing your health issues or discussing your sexual issues with your partner or doctor or a close friend. But be sure that don't go to the Google. Google is the worst doctor on the earth. I and Darshna quote has sought many times. But you go to a proper person who has a definite scientific knowledge. So being sexually healthy means that you understand that sexuality is a natural part of life. It's going to be there in the rest of your life. There is no age. These are myths and beliefs that this is the age where you should enter into a sexual relationship or you should not. Recognizing and respecting the sexual rights we all share. Fortunately or unfortunately, the female hormones start declining at age of 40 and declines completely by 50-52. But male hormones are strong till 80 years of the age. So I said it is both fortunate and unfortunate. Fortunate is that at least you have somebody to care. Nahi to banne sama health issues thai jai, then you have nobody. So you are fortunate that at least spouse is strong physically, mentally, sexually. And unfortunately is that no man understands this, that this is her hormones which is making her fragile. It is the hormones, that's why she is crying. She wants to feel with the family. She started feeling that everybody is moving around, nobody is caring for me. That empty nest syndrome starts, kids are moving to the college, going to the abroad. She becomes lonely. Spouse usually take them for granted. કે હવે 20 વર્ષ થયા લગને શું મારી પાછળ પડી છે. So this is what the time when she becomes fragile, but it is the hormones which are making her fragile. It is the absence of feminine hormone which is giving her this difficult stage physically, mentally, sexually, socially, at so many things. So whenever required, you can have access to the health information, education and care. You need to see your doctor if you have some problems. Making efforts to prevent unintended pregnancy and any sexually transmitted disease. being able to experience sexual pleasure, satisfaction, and intimacy when you need it. There are some time when you are really down with some problem, and this is the time when you need a intimacy. Being able to communicate about sexual health with others, as I said, you have to talk to your partner. There can be mismatch between the desire level. There can be some discomfort about the timing and so many things, but you need to talk it out. You have to talk to your spouse. Sexual health in mid-age, as I said, it is a socio-cultural context. So that's why women are not speaking. There is no point in comparing between one or other. You might be talking to your friends about, sometimes if very close, but there is no point in comparing between the two women's any sort of health. You just have to be aware that it's your need, it's your discomfort, it is your desire. You have to respect it. Indian society, sex and sexuality still considered as a taboo. Global scenario is totally different. How it is totally different? That these are the problems you come across after the age. There is a dryness in vagina, frequent urination. So many of the time we have seen women are little bit resist, even if she has a desire. But she is a bit scared because she has a pain in vagina because of the dryness. She has that fear that I may lick urine while sexual intercourse. So there, she feels that spouse may feel that something is smelling bad. So these are the small things which are very well treatable. But many of the time they do not come. 60% of women having stress urinary incontinence are not telling even to the spouse that she is having this problem. This is what the Indian scenario. So these are the problems you come across after 40 years of the age in your happy, healthy sexual life. But my recent experience, I went to Vienna 2 months back for training in a cosmetic vaginal surgery, European College of Aesthetic Medicine Surgery. The scenario is different, absolutely different. There the mid-age women are coming to the clinics for their vaginal tightening or vaginal rejuvenation. They want to enjoy their life to their fullest, and that is the happiness moment for them. So there is nothing wrong. We cannot compare one country's culture with other or a world scenario. But this is the fact now. Mid-age women are getting or going to the other, like the facial lift or facial rejuvenation. They are also going for the vaginal rejuvenation and some of the cosmetic surgery. They want some external genitalia if they are excessive in a size. So they are going for the trimming so that they do come across with the less pain or less difficulty during the sexual intercourse. This is what I learned last time, and I was amazed to see that many of the women, they find it that if somebody's emotional satisfaction or happiness or healthy life is attached with that, so that's fine. There is no harm in doing that. There is economics. Somebody might be thinking that they are the costlier surgery, but when you are getting your happiness or self-esteem boosted by getting done some of the laser treatment for vaginal rejuvenation or dryness or to avoid stress urinary and incontinence, it's fine. There is a paradox in the world. Somebody wants to do it, so she is bad, or somebody is shy about talking it, or she is talking it openly, so she is like this. We cannot label anybody. Every woman has a different desire and difficulties. This is the website. Usually what we are opting for Western names for the hotel or kids. This is a very big American Sexual Health Association. They have given name Asha to their program. And if you go to this website, you find that there are so many podcasts. You might listen that some old ladies podcast about my sexual awakening at age of 70. And they are discussing their sexual appetite. So there is nothing wrong if those women or any particular woman, even if in the Indian society has something or their happiness is connected to that, her emotions are connected to that, so that's just fine. It's a new era of management, as I said, that fine-tuning emotionally and physically. What they call in the Western world is a Barbie doll vagina, where they are trimming that external labia and making it as young, and it does help women to improve their emotional health as well. So this is what I wanted to talk. If you have any questions, you can talk to me later on. Thank you very much. There are different perspectives about men and women. As I said, for a man it is a different orientation, and for a woman it is a different orientation. In a male dominant or driven society, you should not be shy of talking about your physical mental or emotional desire. તમને કંઈ કરવાનું મન હોય કે મૂવી જોવા જમે, you have to speak it out. We are usually waiting કે ઘરે આવી જાય, છોકરાઓનું શું પ્લાન છે, હસબન્ડનું શું પ્લાન છે, and then you speak out કે કંઈ ના હોય તો મારું આ મન છે. No, it's not like that. Even if this society, you have to learn to live, and you must live to your best. Thank you very much.